Hi, it's Patty Daso. I'm the respiratory therapist here at Hawthorne Medical, and we are changing our procedures for our CPAP setups for the time being due to the coronavirus. We will be doing setups where we just bring you out your machine and all the settings will already be in there. We will have given you a mask to our best guess for you. And if you're watching this video, you should already have your machine. And if you're watching this one, you should have the RESMED Airsense 10. And this is how you will receive it. Your machine is here. Your humidifier chamber slides right in like that. Your tubing is back in the zippered portion. And all your manuals will be also in here. Your power cord is right in there, and that's where you can stow your mask. Now, I'm going to plug this up. There is a plug right here on the back, and plugs in right there. Now, your tubing is going to fit here. You will all receive a heated wire tubing. I don't know if you can see that little coppery color in there, but there is a copper wire that runs through here. The copper wire will increase, it heats this up a little bit, and what that does for you is it increases the humidity level you receive, but it is also a safety feature. It helps prevent any condensation or rain out from getting in the tubing. And as we know, bacteria likes to grow in warm, wet places, so that is one of the reasons they do this. Now, the tubing has this little chip that you're going to need to line up on the back. You just line it up and push like that. This does rotate from side to side depending on what side of the bed you're on. Right here, you're going to squeeze and pull to get it off. So pretty easy right there. I'm going to show you the filter now. The filter is over here. You are going to want to take this out, check it every couple of weeks. If it's dusty and dirty, you're going to need to, you can beat it out a couple times, but after that you really just need to change it. It is disposable. All the air that powers this machine is drawn in through this filter, so make sure that this is unobstructed, like no bed sheets or curtains or anything can get sucked into that. Now, over here we have your humidifier chamber. It just slides in and out. You open it up from the side and you want to fill it up to the max fill line every night before you go to bed with distilled water. This piece also comes out. All of this is dishwasher safe if you want to wash it that way. But all your equipment, and all being your tubing, your water chamber, and your mask, they need to be cleaned at least once a week. You want to just throw them in the kitchen sink with hot soapy water. Whatever your dish soap is fine. Dawn, Palmolive, Ajax, doesn't matter. But what we don't want you using is any of the fancy stuff. The fancy stuff has skin softeners and lanolin that actually can gunk up your equipment. So now I'm going to go through a couple of screens so that you will know what you're looking at when you get your mask on and turn your machine on. Now, this button right here is your on-off button. One button, two features. You are going to put your mask on and turn on the machine on. Now, the machine is quite quiet. You probably can't hear it on this video, but this is your display screen, and it goes dark rather quickly as you will watch me push this button. But on this screen you will see your individual pressure setting. Now everybody's pressure setting is going to be different. This is just an example of what a pressure setting would be. Down here in this lower corner is a auto ramp feature. Now this feature is primarily for new users, and what it does is your therapeutic pressure setting, start pressure, is 6. Well, this is going to bump it down to the lowest level, which is 4 on this machine, and it will stay on 4 until you fall asleep. This machine has got a fancy algorithm in there that knows when you fall asleep, and it will wait till you fall asleep and then rise to your first therapeutic pressure level. Down here in this corner is your humidifier setting. It is also set on auto. What that means is the computer once again is going to run the tube temperature and the humidifier temperature. The air that's drawn in through the filter, the computer measures the temperature and relative humidity of the air of the room that you're in, and it will automatically adjust your tube temperature and your humidifier in order to deliver a relative humidity of between probably about 81 and 85%. But I will tell you, even though you have all these fancy humidity things, CPAP during the first couple of months can be very drying until your brain gets used to the new you, and you'll start producing more saliva and more mucus, and it will improve. But just expect to have some dry mouth and some dry sinuses. Next up on the hit parade, so that's just your display screen. You will get up in the morning and turn it off. Same button. And this machine automatically will default to the report screen. It will tell you, well, and it defaults to that screen because it wants you to look at your data. It'll tell you how long you wore it. It will tell you if you are still having any apneas. You're going to want this number to be less than 5. Less than 5 is normal. Next is, how did your mask fit? You're going to have a green smiley face or a red frowny face. If you get a red frowny face, do not panic. I wear CPAP too, and I have a red frowny face on my machine probably 2 days a week because all masks leak. At some point, you're going to roll over and smash your face in the pillow, and your mask is going to leak. So it does not mean you did not get your therapeutic pressure. As long as your apnea-hypopnea index is 5 or less, you are good to go. So you can then scroll down, and this is all the data that gets transmitted to your doctor and to us every day. So you want to make sure you leave your machine plugged in. There is a built-in modem in this machine that transmits your data, and we can even make changes remotely to your machine, which will certainly help during this time frame. So you have one more screen to go. We were just in the sleep report. Oh, by the way, this is not a touch screen. We have one more screen to go. You were in the sleep report. Now we're going to scroll up to My Options. And frankly, this is a little bit misnamed because you really don't have very many options. Everything is already dialed in by me. The only thing that you may need to change is right down here. And that is the mask setting. You push that and you put in what type of mask you have. Now we're going to be in another video going over some of the masks so that you have a feel for that. But for now, you may need to change that at some point. So that is basically it for this device. We will be doing the other CPAP machine in another video, the one we carry. So you guys stay safe out there, wash your hands, and hopefully we'll be seeing you back in here in a few weeks. Thanks.